COVID-19 and heart health, and we spoke with a heart doctor via Zoom earlier this week to get tips and important information about the heart health in the midst of this pandemic.
Dr. Sinatra, thank you so much for chatting with us. Really appreciate it.
It's good to be here, Rod.
So I know a lot of discussion has been brought around COVID-19, the coronavirus, and how that impacts people with pre-existing conditions. But let's talk for a moment about how it impacts heart muscle and heart health.
Well, I'll tell you, there was a study that came out of China a little while ago, and out of about 419 patients, almost 20% of them developed what we call like a myocarditis-like situation, the inflammation of the heart. They developed cardiac-related issues. So my concern as a heart specialist is that whenever you get a viral influenza of the lung, because the lung and the heart are so interconnected, that you can see myocardial situations occur maybe a few weeks after the virus, maybe a month or two even after that. So even in prior epidemics, when I saw flu-like illnesses, I was always worried about seeing a myocardial situation. Now, the good news is this: lots of times they can clear up on their own. So the patient gets sick, they get a little swelling, they gain a little weight, they get a little shortness of breath at night, but they need to notify their doctor. They really do. A simple echocardiogram, that's a non-invasive test of the heart. It can make the difference, because if the heart is involved, you want to get your doctor involved early in it.
Are there any precautions that people can take to kind of help ward off problems that may be coming?
You mean, what can you do to help you get a stronger immune system?
That's it.
Well, if you're my age, you're done. Well, no, not really. Actually, I just saw this came out. If you're between 18 and 30, there's like a 20% mortality. But if you're over 80, there's like an 80% mortality.
Oh, wow.
So the younger generation, I'm so happy that at least, it's good to know that information. But I'll tell you, being a male, for some reason, males are more affected. Being African-American, more affected, fortunately. Now, I don't know if that's due to ethnicity. It could be, or, more Afro-Americans get more higher blood pressure. That's been my experience, as a cardiologist. So, and the high blood pressure is a comorbidity. I think the worst one, Rod, is diabetes. I really
Diabetes,
do.
yeah.
And the reason being, there's a lot of diabetics who are overweight. We call it type 2 diabetes. In other words, you have, more weight, and you have more insulin resistance. Your hemoglobin A1Cs are higher. A lot of people take oral medication. But here's the deal with diabetes, Rod. The deal is this, that if you can lose I'm talking about mere 5 to 10 pounds, and you shift your blood sugar downward, or your hemoglobin A1C comes down, remember this: inflammatory cytokines, these viruses and everything, they like to live in fat cells. So if you take away the fat cells, you take away their home. It just makes sense. So in this epidemic, I would tell people to eat less carbohydrates, avoid sugar just avoid it. Don't even use it. I mean, if you use it in your coffee, try something else. Go for walks. In other words, get some sunlight, get some vitamin D. Like I said, eat less carbohydrates and try to lose a little bit of weight. If you do that, you're going to fortify your immune system. And I like that.
So the big focus during this pandemic has been social distancing and wearing a mask. But is that enough? Researchers at Florida